the strongest guy in my office, almost didn't make it. After more than 40 years in medicine, these are some patients I'll never forget. This is one of them. He wasn't actually my patient, he was my medical assistant. Strong, dependable, the kind of person who never complained. If something hurt, he'd work through it. That's just who he was. One morning I noticed something different. He wasn't walking quite the same. Every few steps, his hand drifted toward the lower part of the abdomen. It wasn't dramatic. Most people probably wouldn't have noticed it. But after decades of practicing medicine, you learn to pay attention to the little things. I walked over and I asked, "Are you okay?" He smiled and said, "I'm fine, Doc. I'll finish my shift and get it checked after work." Most people would have simply accepted that answer, but I didn't. There was something about the way he said it, and something about the way he was standing that didn't sit right with me. So I asked him a few more questions. Where the pain was, when it started, and how did it feel when he moved? Then he began to explain a lot about the pain, and I was so glad he did. It started in an area around my navel or belly button, and then it later moved over to the right lower quadrant area. When we see that type of pattern, generally we think of appendicitis. Finally, I looked him in the eye and said, "You're not finishing your shift today. I want you to get a CT scan of the abdomen immediately." And so what we did then was, let's go and get a CT scan ordered to see exactly what it looks like down in your abdominal area. Because if I'm right, if I was right, time mattered. A short time later, the results came back. His appendix had already ruptured. What he thought was a stomach ache that he could deal with later had already become a life-threatening emergency. When the appendix ruptures, bacteria spills into the abdominal cavity, causing a serious infection called peritonitis. Without prompt surgery and antibiotics, that infection can spread rapidly and become life-threatening. Now, this is a condition that, in years past, many people who have had this condition, it's an abject surgical emergency. And if you don't go forward and have surgery done immediately, some of these patients can actually die. And how do they die? This ruptured appendix, it has bacteria inside of it. And the bacteria spills over into the peritoneal cavity. And in that cavity, it can become infected so bad until it causes a generalized peritonitis. And that's just doctor talk for saying that the infection is all throughout the abdominal cavity and touching many of the organs, including the kidney, liver, spleen, intestines, colon. And that is a condition that gives you overwhelming sepsis, many times where people die before they can even get to the emergency room. And so it's so fortunate that we did the CT scan and went on and had this evaluation done so he could go to surgery. He went to surgery and it was miraculous. The fact that he was able to go to surgery immediately was a blessing. And next, the fact that it had walled itself off, even though it ruptured, was another blessing. There was no peritonitis, but peritonitis was probably going to be just around the corner, seconds to minutes. Here's what I want you to watch for. Appendicitis often begins as pain near the belly button before moving to the lower right side of the abdomen. The pain usually becomes more severe over hours and may be accompanied by nausea, vomiting, fever, loss of appetite, and pain that's worse when you walk, cough, or hit bumps in the road. If you experience these symptoms, don't wait to see if it gets better. Get evaluated immediately, please. That day reminded me of something I'll never forget. Strength isn't pretending you're okay. Strength is recognizing when something is wrong and having the courage to get help before it's too late. My assistant recovered because we acted quickly. Not everyone gets that second chance. I'm Dr. Lee. For more than 40 years, I've cared for thousands of patients, and now I'm sharing the lessons I've learned so you don't have to learn them the hard way. And so that's a patient that I'll never forget. Subscribe and follow, because the next story I tell could actually save someone you love. If you want more stories like this, comment stories in the comment section. God bless you, and I'll see you on the next video.